When should you follow health tips for bladder health more closely? Have you ever wondered when it's particularly important to pay attention to bladder health? Maintaining good bladder health is essential for overall well-being and reducing the risk of bladder-related issues. There are specific times when you should follow health tips for bladder health more closely. First, as you age, your bladder function can change. This change can lead to an increased risk of problems like incontinence and bladder cancer. The risk of bladder cancer rises significantly in older adults, particularly those aged 65 and above. If you are getting older, it is crucial to monitor your bladder health more closely to catch any potential issues early. Next, if you have risk factors for bladder cancer, such as cigarette smoking or exposure to harmful chemicals, you should be particularly vigilant. Occupational exposure to substances like aromatic amines found in textile dyes and rubber can increase your risk. Regular checkups and monitoring for symptoms are essential for those with these risk factors. If you experience any urinary symptoms, it is time to pay closer attention to your bladder health. Symptoms like difficulty starting urination, a slow urine stream, urgency, frequent urination, burning or pain during urination, blood in the urine, or changes in your bladder habits should prompt you to consult a healthcare professional. These could indicate infections or other serious conditions. Additionally, if you have a family history of bladder cancer or genetic predispositions, such as BRCA gene mutations, it is wise to follow bladder health recommendations closely. Regular screenings and consultations with your healthcare provider can help manage your risk. For men, if you have undergone prostate surgery or have an enlarged prostate, you may experience bladder control issues. Conditions like stress incontinence or post-micturition dribbling requiring careful management. Pelvic floor exercises and medical follow-ups can help. If you have an overactive bladder or other bladder disorders, adhering to bladder health strategies is essential. This includes lifestyle changes and possibly medical treatments to help manage symptoms effectively. To maintain good bladder health, you can take practical steps. Avoid smoking and exposure to irritants. Stay well hydrated, but limit caffeine, alcohol, and artificial sweeteners that can irritate your bladder. Practicing pelvic floor exercises can strengthen your bladder control muscles. Always seek prompt medical evaluation for any urinary symptoms and maintain a healthy weight while managing chronic conditions like diabetes. In summary, follow bladder health tips more closely if you are older, have risk factors for bladder cancer, experience urinary symptoms, have a family history of bladder issues, or have had prostate-related treatments. Early attention and preventive measures can help maintain bladder health and reduce the risk of serious conditions. Always consult healthcare professionals for personalized advice and evaluation.